What's up, everybody? It's David. I'm your host of Highway to Health podcast. Appreciate you being here. It's a fun episode today. If you know anything about Highway to Health, this podcast is meant to celebrate the people, the organizations that are committed to improving patient access, patient experience, and patient outcomes. We have a special episode today. Our guests today are making history, and I'm going to let them tell you a little bit about that history, and it's an honor to be a part of it in some ways. And so I'd like to introduce Rachel Pugliano, Jamie Hill-Walters.
Hi.
And Anna Stevens.
Glad to be here.
Thank y'all for being here. It's an honor to have you. Y'all are doing some exciting things, not only with HFMA, but at your organizations as well. So we're going to get into all that. I start every podcast the same way, Rachel.
Okay.
All right. And I ask for you to share one of your healthy habits, something you do to maintain physical or mental well-being, because we've got to perform for the people that we love and the people that depend on us. If you don't mind, would you share a healthy habit that you've implemented?
Hot yoga.
Really?
The hotter, the better.
Okay.
And for two reasons. It's good for your body, but it's, they're longer sessions. So it's about an hour and a half. And there's no phones. There's no music. It's just you and the instructor and a lot of heat.
Yeah.
And so it's a mental thing. It's a physical thing. But then it's one of those things too. If I've got something that is bothering me or that I'm thinking through, I take that time to do it.
There's plenty of heat in San Antonio too.
I know, but it's different in there.
I know it. Jamie?
Sure. So my secret sauce, my medicine, if you will, is being of service to others. So there are nonprofits that I volunteer, that I love to work with, that are near and dear to my heart. And there's nothing better than getting out of yourself, but being of service to your community.
Yep.
And I'm also an artist. So when I get in the studio every weekend, it's a really great way to kind of clear my brain and also do something creative for my mental well-being. So paints, acrylic on canvas and some sculpture.
Oh, cool.
But it's really become a blessing to it's like that Etch-a-Sketch. It kind of clears my mind.
Yeah.
And the more creative we are in rev cycle and finance, the better. But
that's
parlaying that into service to you of helping others is how I stay mentally fit.
I like it. Yeah. Thanks for sharing. Anna?
Yeah. So for me, my brain goes 90 miles an hour all the time. I have 2 young children. So for me, I start my day every day with the first thought being it's something I'm thankful for. And then taking it a level deeper. So why am I thankful for it in that moment? So, a lot of people are like, oh, I'm thankful for my family or I'm thankful for my house or whatever. But truly in that moment, why are you thankful for it? What does it mean to you? And what are you grateful for? To reflect on that. Because once my day gets started, who knows where it goes.
Right.
And I could probably not remember what I did when I started today. So I like being able to just take a moment, pause and be grateful for something because I have so much to be grateful for.
How old are your kids, if you don't mind?
I have a 10-year-old and a 5-year-old.
Okay.
So
boys, girls?
Busy. A boy and a girl. The 10-year-old's a boy and the 5-year-old's a girl.
Okay.
The 5-year-old's personality is far beyond that of my 10-year-old. So it's fun.
I can relate. We have a 10-year-old boy.
Okay.
And a 4-year-old girl who'll be 5 in December.
Yeah.
And she'll whoop him.
Oh yeah.
We have 2 others, but those 2, man, couldn't be more different.
Yeah.
So it's funny. I appreciate you sharing those things, all of y'all. Appreciate it.
I love that you said pause because I wear a bracelet that says pause.
So how cool.
And I do that because throughout the day I want to pause to give thanks or just need to take a quick pause. But it's my favorite word right now.
Oh, that's really
great.
I don't know how y'all do it. Y'all have full-time jobs, families, and then you also devote so much time to other associations, other organizations, HFMA being the one that we're going to talk about today. Rachel, South Texas chapter. Jamie, Lone Star. Anna, you're down the Gulf Coast.
I am.
And you ladies are leading your individual chapters, and y'all have initiatives that are very specific to your community. And they all tie into what, Greater HFMA is focused on. Anna, if you could talk about, the initiative that you've identified for the Gulf Coast chapter, and then we'll work down the line.
Sure. So our big initiative this year as president for the chapter has been to just make sure we're inclusive with all different types of people, whether that's, age and maturity in your career, whether that's, your geographic location. Our chapter is very spread out. We have one of the best medical centers in the state in Houston, but there's a whole large rural area in our chapter that we have to make sure is included in our in resources that HFMA provides for the chapter. So, making sure that everybody is included in the way that they can bring their viewpoint to the chapter is really important. Pre-COVID, I think our chapter did a pretty good job of that. COVID obviously had a negative impact on our ability to bring people together. Sure. So it's really exciting to be able to get back into that routine. The most exciting thing for me is being able to actually witness that happening. So I'll give you a couple examples. So we had our mini LTC Leadership Training Conference in Houston, and the most exciting thing to me, it was most of the time that's attended by people that want to be leaders or have been involved in the chapter before. There were 2 individuals that had never been at any HFMA event before.
Really?
One of them had literally flown in and moved in from from Washington the weekend before. And she saw that and she was like, "Hey, I want to get involved." And she came and I was like, "That is so exciting!
Yeah.
What a cool way to experience that inclusiveness for people that geographically had not known about our chapter before." So then the second thing was last night we had our happy hour for the chapter. And I was there, and this lady walks up that I did not recognize, and I shook her hand, introduced myself, and she said, "Hey, this is my first event." And I was like, "This is so cool!" As the year goes on, we continue to experience these people that have just never been involved coming out to our events, and that's exactly what my initiative is. And that's really cool to see it.
That's awesome.
Come to light.
That's what we need. We need more people, and we need more engagement. And so that's a great initiative. Jamie?
Yeah. So this year we focused on energize and elevate, and we want to nurture that next generation of leaders. And what we've also found, there's a lot of people wanting to make a move to healthcare, but they just don't know how. And part of it is educating the community on what is revenue cycle, what is finance, why is it fabulous to be in the space we're in, and how are we serving our communities in doing so. And so what we really tried to focus on is what's meaningful to that younger generation, and service is really the underlying thing. So we're doing more activities where we're volunteering in North Texas Food Bank, right? We are volunteering for Family Gateway, Chef to the Shelters. There's a whole list. And what we're finding is people want to show up to be of service, to have purpose. And if HFMA can provide education, bring in students, help early careerists, help also people that are mature in their career, provide certifications, there's this whole library of opportunity for people. And we need to really energize and elevate our community to be aware of that. I was just meeting with a client actually in Florida, and I was walking by one of the desks of, just really an end user, right? Someone that's doing the actual work. And there was a CRCR certification on their desk. And I was like, I probably thought I was crazy, but I was like, "Oh my gosh, congratulations." And she's like, "Who are you?" And I'm like, "You got your CRCR." Because if we are investing in our teams and if we're investing in our communities, these certifications are a big deal, right? So that's what we're trying to do.
That's awesome. Yeah. Thanks for sharing. Rachel?
So the theme for this year is community and service. So it sounds very similar to what Jamie was just sharing. Traditionally in South Texas, for all of our events, we do have a portion that gives back to the community. We usually have a charity of choice at any of our conferences, and we will donate on the speaker's behalf to those charities or those organizations. And so it's great that we've been doing that traditionally for years, but we wanted to take it a step further where we actually get involved on site at one of our organizations. Okay. And we really just wanted to demonstrate that, South Texas HFMA is here. We're a part of this community. We all live and work at the healthcare organizations throughout the city and in our region. So we're going on site this time to actually hands-on work with the organization, contribute for a day or a half day, whatever the individuals can provide. Sure. And so it's actually taking place next weekend, December 14th. All of us are going to be participating in our various locations. Yes.
Very cool.
So we that's something that we decided to initiate this year. And we have a sign up for it just so that I can let the organization know what can they expect. Sure. And we've had an overwhelming response. I'm actually hoping that they can handle us. It might be. Yeah. So I'm really excited to see people are bringing their children, their family members. So everyone's really responded enthusiastically for this event. So we're very excited.
Actually being a part of the community. Mm-hmm. and getting your hands dirty in some ways.
Yeah.
In a good way. We kind of buried the lead, and I'll take the blame for that. What are we celebrating? Jamie, look into this camera
What are we celebrating?
and tell this crowd what we're celebrating today.
So for the second time in history, Texas has 3 female presidents with HFMA. And they're sitting right here, right? However, it is the first time in history Texas has 3 female presidents, and HFMA National has an amazing female CEO, Ann Jordan. And it's been wonderful, really, to watch her lead the organization. But it's been wonderful for the 3 of us to really bring our chapters together and have more of a Texas strategy versus a chapter specific. So we're really excited.
Well, and you're exactly right. It's pretty exciting. And congratulations. I mean, it's awesome individually as an achievement. It's also awesome for the organization, for the association to get it done.
Yeah.
And we have our own individual chapters. You mentioned Ann Jordan, who's the national CEO. Tell us how each chapter plays a part in accomplishing the end goal, being a cohesive association. And no matter what chapter we're a part of, where we are in the country, we're all striving for the same goal. How do we work together across the country, across these different chapters? Anna, you want to start?
Sure. I think one of the things that, and I'll bring it back down to the Texas. We'll start with Texas. One of the things that the 3 of us ladies did was we implemented a call where we just get on a call and talk to each other. I mean, it's a simple thing of communication, but it's amazing how far that goes. And we can get on a call with each other and be like, hey, I'm seeing this. What are you seeing? These are some of the things that are required of us. How are you implementing them? I'm having a lot of success in this sponsorship opportunity. How are you doing it? And that just, those tentacles that start at the local level start spreading into the national level. And so I think, a simple idea of communication goes a long ways. There are a ton of other things, but I found that one to be the most standout for us. We just simply started with scheduling a call, and it's been amazing what that's done.
And it's just 30 minutes. It's not like we have to spend a lot of time.
Yeah. I've found when I ask these questions about your mental well-being or your physical well-being, the best answers are the simplest answers and things that you can do repeatedly and consistently. It sounds like this is a step towards that. Rachel, what do you think?
So Anna talked about Texas and what we're doing from the state perspective within our 3 chapters. There are a lot of things that HFMA does from a national level to try to pull us all together. We do have opportunities to meet the leadership specifically with all of the other leadership teams at the various chapters. And we're able to do that, I would say, probably twice a year between the events that they offer to us. And they do a really good job of mixing us up so that the 3 of us just don't, go sit together. We're with people from California or New York, Minnesota, all these different states. And we get to hear from them and visit with each other around what's working in your chapter. What are you doing in these different areas? We get great ideas from those conversations. And I have people now that I'm connected with on LinkedIn. I have their email addresses. And even just simple things like, hey, do you have a really good spreadsheet that you use for the budget or something like that? I can reach out to people from all across the country.
True community. Better together type idea. Jamie, anything to add?
So for me personally, everything I do is aligned with my core values, whether it's HFMA involvement, whether it's career, art, nonprofit, whatever that is. And I think from an HFMA perspective, all the chapters are aligned with HFMA's core values, right? And when you look at that, we are part of a Region 9, which is like Oklahoma, Louisiana, Arkansas, Mississippi. I feel like I'm missing one. Texas.
Yeah.
But we get together on a regional basis. And what's wonderful is that we can share ideas with these chapter presidents. But why reinvent the wheel when something is working in other areas? So it truly is a gift. And I believe when we all get together, those core values truly come to play.
Regionally, I'm sure we share a lot of the same challenges or opportunities. But we're probably pretty different from some of the things that they're experiencing, the chapters that are experiencing things in California and other areas of the country. Anything stick out in your minds as something that might be specific to Region 9, specific to our area and our chapters, compared to, the Californias and the New Yorks and the other areas of the country, and then something that we maybe share as a challenge or an opportunity nationally? Anything stick out to you? Jamie, I'll start with you.
Texas is Texas. We only care about Texas.
We're the best, right? We're the best, right?
I mean, you know how it is. But there is. I mean, there is difference. There's challenges. I mean, I think from a finance perspective as well that you guys could dive deeper into. One of the things that we are seeing kind of consistently across the board is the adoption of AI. What does that mean? We're communicating to 5 different generations now, regardless of where you are in the country. How can we meet people where they are and really communicate the value of that? Because people learn differently and they absorb information differently. So I think what's kind of similar across the country is bringing awareness and education about what the future of healthcare is going to look like when it comes to the automation and AI.
Yeah. Anna?
I think that's an interesting topic that you bring up, because I was just recently in New York and we were talking about AI. It came up a lot. It was almost the theme of the conference. And it was very, very interesting to hear from actual MDs and providers on their perspective on AI versus maybe somebody in the finance space that's working on the back office or something like that. And I was moderating a panel with 3 MDs and 1 CIO, interestingly enough. And the 3 MDs were like, no way.
Really?
And the CIO was, love it, which was interesting.
That is interesting.
But the MDs brought up a really good point. In AI, when you're dealing with a person, you have literally no margin of error, right? So you can't utilize AI and hope you get it right. You can have a margin of error in the finance back office. Like, that is okay. Nobody's going to live or die from your margin of error. And so it made me think of, it's very similar to like a life science space where you have a medical device you're implementing or a new drug. You have to go through so much FDA approval. And so before it's actually ever out in the market. And I think that's going to be very similar to how AI in the clinical space is going to have to look. It's going to have to go through so many reiterations of trials and use cases to where you're willing to accept the margin of error before you're ever going to see it utilized in the clinical space. And I think it's going to be very similar versus you can utilize it pretty much today in the finance space in rev cycle. So it's very interesting when you're talking to same industry, but who you're talking to and where they sit in the industry as to their viewpoint of AI. So I thought that was very interesting.
Levels of liability. I mean, are going to dictate a lot. And you mentioned drug trials and things like that. 10 years of research.
Right.
That's probably a timeline that we'll see with AI in the clinical setting. And I can empathize with that, as I'm kind of a control freak. And if somebody's life was in my hands, I wouldn't want to share that responsibility. I'd want to own it. Rachel, anything to add?
A little bit maybe different, but so thinking about Texas and how we might be unique or different from some of the other chapters.
Cowboy hats, boots.
Definitely the attire. But I think the size of our state is a unique challenge, and just the geographical boundaries of our various chapters. So for South Texas, we're San Antonio, Austin, Corpus Christi, but then also the entire Rio Grande Valley. And they're very spread out in that geographical area. So that is a challenge for us to bring awareness to what HFMA can offer those organizations and reach them where they're located, just because of the vast size of our state. So, and I'm thinking Lone Star, you probably have a lot of the same issues because you extend more west. I had to do my think about
it. We're all the way from El Paso, all the way,
Really? Lone Star chapter?
Yes.
All the way to El Paso.
So think of that as the line where Temple, Texas, all the way across and up. So how do we reach those underserved communities when it comes to education? And obviously, webinars. We just did collectively, we're so proud of it. We did, our chapters came together and led it as CRCR boot camp. And it was 3 sessions and then 1 additional session in December. But and they got CEU credits. So not only do they get CEU credits, they can pass the CRCR. But we had 400 people attend this.
Yeah.
Really?
The first time we've offered this.
First time, 400 people.
for Texas.
Wow.
Yeah.
Mhm.
Each session.
It's usually like working out. It takes a while to get the results, but 400 people.
When you join forces
yeah.
and you really promote it and reach those
Mhm.
more underserved communities that can't, maybe can't come in person.
Yeah.
It really opens up the opportunity, and that's how we're getting creative.
That's awesome.
It is.
Congrats.
Yes.
So this could lead to, I mean, we don't even know where it could lead. It's, since it's the first time and we're just wrapping up. So it might create that opportunity for these individuals that participated to come to one of our events or even want to host an event or something like that.
What's cool about HFMA, your role is the other side of the coin, in my opinion. You all work for organizations that understand the obligation and the commitment it takes to be in this role with HFMA.
Mhm.
I think that's a special piece to this recipe. Tell us a little bit about the organization that you work for full-time and what they've done to empower you and the opportunity they've given you to be a part of HFMA in the way that you have been. Rachel?
So I work for Eide Bailey. They are headquartered actually in the Midwest. I think the very first office opened about 100 years ago.
Wow.
And literally 100 years ago in Fargo, North Dakota. Now we have offices all over the country, but we are primarily west of the Mississippi, slowly kind of expanding east, but that's our primary geographical location. And it started as a traditional accounting firm, audit, tax, that type of work. But the healthcare piece of the practice has a very large consulting business, and that's where I reside and that's where I work. So I'm in the healthcare revenue cycle services. There's about 14 of us on that team. So we have a pretty robust team, all different backgrounds and skill sets. And because of revenue cycle being such a prominent piece within the HFMA organization, my company is very supportive of our involvement in HFMA, not only just showing up at an event, but volunteering to be on a committee, being on the board, entering into the leadership track. And I think that I showed up to my first South Texas. I'm originally from Minnesota. So I showed up at my first South Texas event 7 years ago. Was it 7 years ago? And around there. And I said, do you need help doing anything? And the first thing they did was put me on a committee. And then a couple years later, I'm the chair of the committee. And then after that, they said, well, do you want to be on the leadership track? And now here I am, the president. So all it actually takes is just showing up to one event and saying, hey, I'm here and I'll help you however I can. And thankfully, my company has been extremely supportive of the time commitment, the travel, the events, all of it. So I'm very grateful.
Has it helped you? Has HFMA helped you in your career too? Like, I mean, in terms of understanding or gaining perspective that allows you to perform in a different way professionally?
A couple of things. So not just meeting different types of individuals across the country, working at different types of organizations that maybe are not part of my client base. So that broadens my ability to kind of look and see what else is going on in the industry. The types of events that they hold and the types of speakers that they bring in, of course, gives that perspective. But I think that the personal growth has also been a huge factor. Just being on a board, I didn't even know how a board worked until I entered into the HFMA world. And so being on a board, understand how do I run a board meeting? Of course, that's new for me this year. And so it's a growth opportunity for me professionally and personally. And it just has, I guess, broadened my my abilities and skill sets.
Well, it's a commitment. I'm sure it feels like you have 3 full-time jobs and not
sometimes. Sometimes.
Jamie, tell us about Janus.
Sure. Janus Health. It's an extraordinary company. I'm so fortunate to be here. And we're really in that revenue cycle automation space. When we look at operational intelligence, workforce management, process intelligence, prior auth, all the hot topics, we're getting to develop solutions to improve cost to collect, cash acceleration. We are really making an impact at these large healthcare systems. And it goes back to, we have this fabulous technology. Let's teach the community how to adopt and utilize it, right? Yep. So they can see the uptick in their KPIs. So very excited about that. What has HFMA done for me? Getting involved and showing our communities that we are helping their teams get educated, that we're doing it with the right motives,
Yeah.
I'm telling you, there's no other way to build a relationship with decision makers and directors and managers than it is to show up and be of service to their community.
Yeah.
And it's not, I always tell people, if you're on the partner side and you go to an event, don't stand by your booth and think people are just going to come to you. Get involved in a committee. And what does that look like? And what is your time commitment?
Yeah.
So for me, the question's always like, well, what's this ROI on this HFMA? I'm like, this is where we're building relationships and we're building trust. People want to work with who they like, who they trust, and if you're genuine. Of course, you have to have an amazing product. But at the same time, that's where the service aspect comes in and being aligned with our core values.
Yep.
So
I agree
could
with that.
go on and on about it. But, yeah.
Well, Anna?
So I'm the partner in charge of healthcare at Weaver. So we are a traditional, CPA firm, audit, tax, and advisory. So I was tasked 8 years ago to stand up the healthcare practice for Weaver. So I had been involved with HFMA for many years before that. And so obviously that, I came in, our CEO is amazing. He's like, hey, I trust you. You get involved wherever you think is important. And so I'd already been involved with HFMA. And I was like, this is a really great organization. The connections that you make is just, it is the bread and butter of how you, really understand the industry. So the firm has been supportive of HFMA from day one. But what's really been cool to watch over the years, over these 8 years, is the rest of the healthcare team getting involved as we built it out. And so I would say 100% of our healthcare team members are involved in HFMA in some way or another, which is really cool. Whether they're in their Dallas office or whether they're in a Houston office. We acquired a firm in California who had a healthcare partner. She came in. She met Sam in the California chapter, and he immediately put her on board. She's on the board of the California chapter. It's just really neat how quickly the different, regardless of the geographical locations, have brought our team members in and got them involved. But what has HFMA done for me? It's really personal as well. I've made a ton of friends. I have a really cool story that so my daughter was born deaf in her right ear. And so the girl that actually introduced me to HFMA many years ago, when I was very early on in my career, right out of college, happened to be the CFO at a hearing, fast forward all these years, happened to be the CFO at a hearing facility.
No way.
And so I called her and I said, hey, my daughter is deaf. We need to figure out how to, get her into, she got the top audiologist to come see my daughter. It was like, that's really cool. So not only has he helped on the, the professional side, but it also is on the personal side as well. So
that's been the coolest thing about the healthcare industry to me is it's a huge industry. It's a tight, small community. Seems like everybody knows everybody. And when you get involved, things like that happen. And that's just another reason for anybody listening. If you're not involved, get involved. Because whether it's personal or professional, it's going to pay off. And you're going to help somebody else as much as they'll help you. True sense of community.
Can I add one thing to it as well?
Please.
Especially, so I'm Chief Customer Officer at Janus, and really my team is accountable for the customer journey. And part of it is I really would love partners like us to invest in our teams that are in front of our customers to go and show up where our customers are showing up at HFMA events. So it doesn't have to just be Texas, Colorado, all over, because just by showing up and participating and bringing that value is a real game changer. Right? We're investing in the community when we partner with people. So,
people, whether it's B2B, it's people in people. That's what really matters. I ask often why people got into healthcare because I'm honest with how I got into healthcare. It was a complete accident, desperation maybe, coaching basketball. Everybody knows the story. Why I've stayed is for a lot of the reasons you guys have mentioned, you ladies have mentioned today. It's about community. It's also a great opportunity. And then you just meet people that you don't want to leave behind. Like you don't ever. And so I'd like to ask you, you can answer this one of two ways, Rachel. Why'd you get in, or why have you stayed?
It's hard to choose how to answer. So I'll tell you how I got in just very briefly, but my mom has been a respiratory therapist since she was 21 years old. She was pregnant with me when she started a respiratory therapy department at the hospital that I was born at. So I've been surrounded by healthcare my whole life. So I think it was just a natural choice to go down the healthcare path. But why I've stayed is because I've seen my career really be able to take off in ways that I didn't even know existed when I began my career. So I started out as a coder, which is working in an office, looking at patient records all day long, assigning codes to those and sending it off and really never really seeing it again.
Yeah.
And I was given some opportunities along the way where I could move into compliance roles, broader revenue cycle type roles, especially with consulting. I get to look at the entire revenue cycle, not just that one pocket of revenue cycle. Yeah. So I've stayed because I've been able to move and change and learn and grow just with that one choice that I made.
That's the key thing for me is like, it doesn't matter where you start. You have no idea what's coming next. That's the cool thing about healthcare. Thanks for sharing. Jamie?
Well, it was 20 years ago. It was really 20 years ago. Oh my goodness. And I was an event planner, I was a fashion, all this kind of stuff, right? And I applied for this meeting planning position at a GPO, healthcare. Mm-hmm. And I went in and I interviewed, long interviews, and I actually got the job. And what it was I managed all of Christus Health's value analysis and clinical committee meetings, all in, obviously the Texas region. And it was a crash course in healthcare. And I was overwhelmed. It was the best gift that ever happened to me in my life. Mm. And I will give a shout out to there's women that have made an impact in our lives. Mm-hmm. And Kim Lemons, she was the broadline who hired me and gave me the opportunity. I always say, just open the door for me a little bit. I will bust it wide open, right? It's up to us, right?
Yeah.
And I'm so grateful for her every day for giving me that opportunity.
Yeah.
Because now she actually works at Christus. But now I know what it feels like to help other women and help early careerists, give them an opportunity where their resumes may not necessarily align with what we need, but they've got that drive and that ambition. So, being on that side of the supply chain side for a long time, and then I transitioned to finance and finance reimbursement and revenue cycle. But I'm telling you, once you learn about it and you understand what we can do to impact our communities and you truly get involved and you align everything with your core values, it is phenomenal when you drive. Let's say you go and visit your customer or your client and you look at these homes and these communities, we are playing a little bit of a part in the lives of these people. And also when I work at companies and there's like an analyst or someone that's just at their computer all day, we need to educate them. What you are doing matters. Lives, and this is how it matters. Yep. So I guess coming around, it's like, I feel like out of respect for the women that gave me a shot, I want to stick around to give other people opportunity. Yep. And on the flip side of things, how cool is it that we get to be of service? Yeah. Yeah. I mean, why would you leave? Yeah.
Well said.
I mean, it's how I feel.
Anna?
Yes. So I'll share why I stayed. So I niched very early on into healthcare right out of college. Kind of happenstance fell into it at the public accounting firm I was at. But then I went to be a corporate controller for a health system. And we had a traumatic brain injury facility. And one of my roles was to go out and meet monthly with all the CEOs. And so I was out there. And this facility had like a fishing pond, as one of the extracurricular activities. Yeah. And I was in the CEO's office and we were looking out, she and I were looking out over the pond. And anyways, there's this gentleman, and it looks like his father out there fishing. And I said, well, that's interesting. I mean, they both look like they could be just normal individuals. Yeah. Anyway, she's like, that's a really cool story. She said that gentleman was out on the oil rig and an accident happened. And he went from being a really strong 21-year-old man to like the brain of a child, literally instantaneously. And his father didn't know how to communicate with him because it's his son. They did everything together. And now he's, has the brain capacity of a child. And so, he couldn't have a conversation with him. And so they would just sit outside at that pond and fish and wouldn't say anything. No words were exchanged. They would just sit there and fish. And that was his way of bonding with his father. And I was like, how cool that I get to be a part of that.
Yeah, that's cool.
And so I was like, this is exactly why I'm in healthcare. And this is why I will always be a part of healthcare, regardless of whether it's in, on the public accounting side or the finance side. That's what I do for a living. But I'm a part of something much bigger, and that's why I stay in healthcare.
It's a great story, and there's millions of them, and I think that's why we're all in healthcare. We've stayed in healthcare, but that's the stuff that people that aren't in healthcare and are looking for a bigger purpose don't understand. You don't have to be the surgeon. You don't have to be the one not trusting AI as a clinician. You don't have to be the clinical resource or the practitioner to be in healthcare and to feel like you're making a big impact. So I would encourage anybody that's looking.
And I think too, like we get to impact the non-clinical side of healthcare, right?
Yeah.
And patients can come in and have an exceptional clinical experience.
Yeah.
But if their non-clinical experience isn't that great, right? That's a problem.
It's going to leave a lasting impression.
That's patient experience. Absolutely.
So when we can do a whole session on patient experience,
Right.
I know, but I really do. I just want people to stay open-minded about what could a career look like on the non-clinical side of healthcare.
I agree.
It's pretty tremendous.
Yeah, you said it best. All right, this is the last thing we got to wrap up here. Rachel, if our listeners could remember one thing from today, what would that one takeaway be for you?
Yeah.
I would say don't overthink it. Just say yes. Just get involved with whatever that might be, whatever interests you, whatever you're passionate about. Just say yes.
I like that. Jamie?
One thing is just get involved. Say yes, get involved. But once we do get involved, we have a responsibility to attract, retain, and bring in that next generation.
Yeah.
Right? A lot of people can be introverts or extroverts or whatever, your talent is. But we have a responsibility to make sure we're inclusive and that we're being intentional as we grow our own teams, as we grow our HFMA chapters, and even in our personal lives. So I really want to leave that as food for thought because we're in healthcare.
Yep.
We're of service. Let's take it even further and be of service to a lot of people. Be inclusive.
I would say it's kind of piggybacking off of both of theirs, but if you've been in the career in the industry a long time, I would say find someone that hasn't, that's new, and take them alongside you and get them involved. And if you are new in your career or to the industry, put yourself out there. I think you'd be surprised at how much of a community it is. I did that, and I have never regretted it, not one bit. I've met some amazing people. So I know it feels uncomfortable maybe, but it's an amazing community. It's the largest, smallest industry is how I've heard it described.
Yeah. Yeah. Well said.
And remember, we get to grow through the uncomfortable.
That's right.
So the more uncomfortable you are, the more growth you have.
Yeah.
That's what I've always followed.
No movement forward without friction.
Yeah.
And so thank y'all for being here. Congratulations.
Thank you.
Thank
on your
you.
achievement. And if you're listening, follow these ladies, follow HFMA, get involved, say yes, and help somebody out. Thank y'all for being here.
Thank you.
Great job.